Thank you, Madam President. I wonder if I can beg your indulgence before I get to the substantive part of my contribution to join with the government in offering congratulations to a new national hero, somebody who perhaps provided the prescription that I think this ailing nation needed. In a few moments, in less than a minute, the accomplishments of Olympian Duane Miller brought a divided country together. As you listened and looked at the emails, the WhatsApps, the memes, etc., that were going around the country, it is clear, and around the world, when you mess with one of us, you mess with us all. And she was able to bring, if only for a little while, every single Bahamian together in unity. And I think she should be congratulated for her accomplishments. I do. I have young children, and that makes me young. I would also like, Madam President, to acknowledge today is the 87th birthday of my father, and an unspecified anniversary of my favorite oldest sister. I have a favorite older sister and a favorite oldest sister. So I wish to offer them both a hearty, happy birthday. God has been good to us all. Madam President, over the last 30 years, there have been a number of efforts to achieve healthcare reform. It has come in the form of specific initiatives or not, radical policy initiatives or not, and I want you to think PHA or Ministry of Health, major building initiatives like the critical care block, Sandilands Rehabilitation Center redevelopment or not. And I just happen to have in my hand today a copy of the report of the Working Party on National Health Insurance, published and delivered to the then minister, my beloved, the Honorable George Mackey, August 31st, 1987. Madam President, if you look at the names of the contributors to this document, there's one Dr. Bernard J. Nottage, who was at that time a consultant and the chairman of the medical staff of the Princess Margaret Hospital. Ruth Millar, Vita Brown, George Sherman, Percy McNeil, Marcus Bethel, Eric Darville. A number of these great Bahamians have gone on, but if you were to read these documents that formed a part of the report of the Working Party on National Health Insurance almost 30 years ago, and I remind everybody that we are barely 43 years old, that we have been talking about this now for almost as long as we have been a nation. And Madam President, here we are in August 2016 to debate the latest initiative intended to advance the state of the nation's health. This time again, we call it NHI. It'll be the second time that national health insurance legislation will be passed in this place and the next. NHI 2007 came and went, and it had absolutely no impact on healthcare in the Bahamas whatsoever. But let me start by congratulating the government for their attempt to engage the Bahamas in an important national conversation. You see, while I may hold differing views and opinions about the how, the what, the why, and the when, and believe me, I do, it is not lost on me that we will not solve any of our nation's problems without real dialogue. You see, if we continue to talk with each other instead of at each other, great things are possible. This NHI conversation has been loud, it has been occasionally angry, it has been emotional, it's been passionate, it has been sometimes absolutely absurd. We have heard exaggerations, accusations, confessions, and loads of details, numbers, statistics. but most of all, for Bahamians listening, it has been confusing. Madam President, the Bahamian people want national health insurance. At least they want what they think they believe they have been told they would get with national health insurance. Let me repeat that. At least they want what they think they believe they have been told they would get with national health insurance. They definitely want better than what they have, as do I. But if you ask any Bahamian to describe or to outline the benefits of this NHI plan to a man, woman, or child, they will get it wrong. As a matter of fact, if you ask any member of parliament on the government side, least on this side, to outline the specifics of the plan, you will get a range of answers as we did in that other place. It has been a ball of confusion. You see, one thing that is very clear, in the effort to sell the idea of NHI, some have embellished, some might say have exaggerated the expected benefits and have dramatically elevated expectations. And Madam President, I shall come back to this again, but I believe as a country we shall live to regret that strategy. You see, I am disappointed in this bill. If this is the best that we could do in 30 years, how long before we do what we know we ought to do, for the reasons we know we ought to do them, not for political expediency or props, but because it is the right thing to do? And Madam President, let me say in summary, I am not disappointed because of what this bill does. I am disappointed because it doesn't do enough. Madam President, we should stop and ask ourselves whether the rhetoric used, whether the characters that have been assassinated, the industries that have been vilified, the uncertainty that's been created in this debate, both in this place and that place and on our streets, was worth it. We should ask whether the fiscal cost of $124 million on top of our national debt, a cost that will be, not maybe, but will be put on the backs of the Bahamian people, was justified by the end product that we see being presented and debated today. I think our people would say that it is a sad testament to the impact of politics and tribalism that we have not gotten as far as we should have gotten. My view is, certainly as a people, we are far better than this. Thank you. So I will support this bill, Mr. Acting President. I wish I could give it glowing praise, but I can't. It is not deserving of praise. What we have before us is indeed a start, but it is a start that I believe will prove to be a great disappointment for the most important of us, and that is the Bahamian people. It is certainly a disappointment for me, a health practitioner who spends the majority of his time working in the public sector. As I said before, it doesn't go far enough. And so today, I wish to spend a little time outlining how this opposition senator can simultaneously express support for universal health care and national health insurance, while pointing out a number of the weaknesses and opportunities for improvements. And I'd like to start with a snapshot of our nation's health report card. We live in a wonderful country. We have a very mature healthcare system, except that we have continued a system that I call medical apartheid. It is a regressive, socially unacceptable system that pretends that separate can be equal. It is a system, Mr. Acting President, that we should have abandoned many years ago. Charles Dickens could just as well have been writing about our approach to healthcare when he wrote A Tale of Two Cities. You recall the introduction. It was the best of times. It was the worst of times. It was the age of wisdom. It was the age of foolishness. It was the epoch of belief. It was the epoch of incredulity. It was the season of light. It was the season of darkness. It was the spring of hope. It was the winter of despair. We had everything before us. We had nothing before us. We were all going direct to heaven. We were all going direct the other way. In short, the period was so far like the present period that some of its noisiest authorities insisted on it being received for good or for evil in the superlative degree of comparison only. So on the one hand, we have a well-developed, state-of-the-art private healthcare system, and then we have Princess Margaret Hospital, the Rand Memorial Hospital, Sandilands Rehabilitation Center, and our public health infrastructure. Now, in some respects, the best healthcare, neonatology, trauma, critical care, are provided in the public sector. But one day, I would like to invite senators to come with me into the Accident and Emergency Department at Princess Margaret Hospital, a place that I had the privilege to lead for a number of years. So you can see firsthand what our people experience every day. I want to offer my heartfelt thanks and praise to the dedicated people who work there every day in the most extreme conditions. They are truly national heroes. But follow me into the holding areas where scores of patients wait, and the same thing happens at the Rand Memorial Hospital, sometimes for days to get a bed. Join me as families agonize over access to tests and procedures not available in the public sector and for which they must pay. Sometimes public patients pay more for certain devices and procedure than they can get it for in the private sector. Join me as we go and visit patients who have surgery that has been postponed week after week for various reasons. Join me in the blood bank, and we see shelves that are empty or inadequately stocked, in large part because we do not yet have a national blood bank, even though we agreed to create one almost at the turn of the new millennium. You see, Mr. Acting President, before this meltdown, when the World Health Organization looked at the Bahamas' healthcare system, we were ranked 94th out of 191 countries. And yet the level of health of Bahamians was 137th out of 191 United Nations countries. By comparison, Canada was ranked 30, United States 37, Jamaica 53, Barbados 46. We ranked 137th. This is despite the fact that we spend $800 million, or almost 10% roughly of our gross domestic product per year on healthcare, with a total expenditure per capita of $2,500 per person. Now, no less an individual than the Chief Medical Officer, Dr. Glenn Benaby, has noted that as much as 25% of our public health expenditure may be wasted. When we look at data from the Public Hospital Authority, published in May 2012, listing the 10 leading causes of death, all ages and both sexes for the Bahamas, from 2006 to 2009, we find the number one cause of death, hypertensive diseases, accounting for 688 deaths, heart disease, 607 souls, HIV/AIDS, 566, strokes, 517, diabetes, 399. We have the worst profile of chronic non-communicable diseases in the region of the Americas. We are among the most obese people in the world, number 6 in the world. We are among the 20 most violent countries in the world. We have the highest incidence of diabetes in the world. We are number 1 in the world in diabetes. According to the latest World Health Organization statistics, in May 2014, hypertension deaths in the Bahamas reached 7% of total deaths. This causes the Bahamas to be ranked number 7 in the world for the severity of high blood pressure. We have the highest incidence of HIV in the region, higher than all the countries save for sub-Saharan Africa. We have the highest incidence in the world of the BRCA1 and BRCA2 mutation that causes our women to get breast cancer almost 20 years earlier and 2 stages later than all other women in the world. And the world average is 1%. In the Bahamas, it's 4%. And so when we put this all together, the Bahamas and secondarily the rest of the Caribbean, but particularly the Bahamas, is expected to suffer horrendous complications from these chronic non-communicable diseases. And in 2007, CARICOM convened a meeting on chronic non-communicable diseases, and I was present at that meeting. And it was predicted at that meeting that we would see in 20 years a 300% increase in deaths, not 30%. Why would we say to our people that if you're poor and you're black, you're going to die unless we introduce this plan?
On a point of order. Mr. President, we are in here today, and I don't think, only 2 speakers so far, not one of us has said that this plan will stop you from dying. And as I listen to the government contributions in the other place, not one person said this plan will stop you from dying. The only person who has the gift of life and death is Almighty God. Amen. And I stand on a point of order, and I would ask the honorable member, and he is honorable, to please correct that statement. No one in government has ever said this plan will stop you from dying, ever.
I thank the honorable senator for her intervention. And certainly there have been, to my recollection, and I have listened carefully to the debate over many months in that other place, and the comments made by the Right Honorable Prime Minister, the Minister of Health, etc. And while I may admit that those exact words may not have been uttered, certainly it is my belief, my opinion, that the content and context that I just expressed was an accurate reflection of the sentiments expressed. Primary health care is indeed the way to tackle the problems of health in the Bahamas. But authorities around the world acknowledge that effective implementation of a primary health care strategy will take up to 20 to 40 years before we see a significant incremental reduction in morbidity and mortality. 20 to 40 years. But in the meantime, our mothers, our fathers, our aunties, and our uncles many of whom have catastrophic illnesses now, will be dropping dead like flies. And so while we have to put in place an effective primary care strategy, we cannot do it without a simultaneous approach to address the problem of catastrophic illnesses. That is the contention. You see, Mr. Acting President, let us get real for a moment. There is no capacity in our public health care system to accommodate and treat many of these patients. This plan looks at capacity primarily in New Providence or Nassau and does not adequately address the challenges of not even Grand Bahama or Abaco, much less Akron's, Crooked Island, Long Island, etc. A great deal of commentary has been made about the private sector and the private insurance companies. I would like the Bahamian people, through you, Mr. Acting President, to hear my advice carefully. If you can afford health insurance, even though it has been made more expensive by VAT, keep your health insurance because you will need it. NHI 2016 is a start, but we have a very long way to go. You see, this plan, which has cost you, the Bahamian people, as much as $15 million, and we don't know the exact amount because it is a state-guarded secret, because we paid Sanagest, and we paid PricewaterhouseCoopers, and we paid KPMG, and none of those reports have been released to the Bahamian public. Who paid for those reports? And I accept that there are many other secret plans being withheld by our government for health care reform. But this plan doesn't go far enough, and this bill certainly doesn't. There are no schedules. There are no details. The government says, give us a blank check to do what we say we will do for your interest. And we will act in the public good. You know, Mr. Acting President, if this government had a track record of being able to be trusted, the Bahamian people probably would give them a chance. But the track record of this government has been so dismal that they are not trustworthy. So while incremental improvements in health care exist for those who can afford health insurance or private care, the truth is this country has been challenged to keep pace with the technological and innovative strategies that have changed the way health care services are delivered. And in 2016, there are a number of services that can only be accessed by patients with independent means. While public-private partnerships have improved access in some areas, state-of-the-art services remain out of reach for many Bahamians or create massive hardship. And the recent worsening of our national economic climate has reduced the ability of private institutions to offer pro bono, free, or subsidized care. Many hospitals in South Florida can no longer afford deep discounting for foreign nationals, and instead they now seek to attract the best financed patients with innovative, typically less invasive services. Most recently, a serious shortage of therapeutic and diagnostic capacity in the public sector has compounded the serious problem of hospital overcrowding. We've spoken about the huge numbers of people waiting for beds in Princess Margaret Hospital, admitted patients numbering from 35 to 60 on some days. On the wards, we have inpatients who await surgical procedures for weeks and sometimes months. And while the public hospitals have been full, non-governmental entities have seen a shift away from private care. With occasional spikes, Doctors Hospital has seen considerable reductions in its average daily census. What is clear is that there has been a real shift away from private health care. Made worse because private health insurance, with the addition of VAT, is now more expensive. Private health care, with the addition of VAT, is now more expensive. And this is likely to worsen unless our economy improves. I'd like to give a specific example, and I've mentioned to the Honorable Senator who serves in capacity as the Junior Minister of National Security. A week ago, we did an open heart procedure on a 72-year-old Bahamian who has no health insurance. He asked me if he waited for national health insurance to be implemented, whether it would help to pay for his open heart surgery. I told him that based on my understanding, it would not. He and his family saved for a very long time to be able to afford the deeply discounted fees for open heart surgery. And yes, it is $40,000 for a public patient to have open heart surgery, which is not provided in the public sector. You have to go over to Doctor's Hospital, you spend a day or two in Doctor's Hospital, you come back to Princess Margaret Hospital. It used to be $37,000, Mr. Acting President, but this government in its infinite wisdom decided that we have to add VAT even to that.
No.
Now, by comparison, the cost of open heart surgery, and I want to read from a paper entitled The Association of Hospital Prices for Coronary Artery Bypass Graft Surgery. It was published by Giacomino Cram and Mary Vaughan, and I'm happy to table it when we're done. And it looked at the out-of-pocket hospital and physician prices for coronary artery bypass graft for patients in the United States in 2014. And they contacted 111 hospitals, and they found that the average price for coronary bypass surgery was $151,784. The lowest price was $44,824, and the highest price was $448,039. We charge public patients in the Bahamas $40,000, $37,000 plus VAT. We cannot do it for any less. I have gone on record as saying that we have to introduce cardiac surgical services in our public sector. The patient, when he returned after successful completion of his surgery, was told by a member of the finance team at Princess Margaret Hospital that since he had surgery at Doctor's Hospital, Princess Margaret Hospital would regard him as a private patient. And so in addition to the $40,000, he now had to find private fees to go to the ICU at Princess Margaret Hospital, and that he would have to find funds to go on the private ward at Princess Margaret Hospital. Now, how can that be right? As I get ready to conclude, Mr. Acting President, we on this side would like to ask the government, where are the secret plans, the Beck Group plans? Where are the plans, and when will they be opened and revealed to the public? When will clinicians and physicians have an opportunity to see what is planned for the development of our healthcare system? Is there a plan to construct, to open a national blood bank so that we have the ability to send teams throughout the length and breadth of this archipelago? What are the plans for a proper cardiac service, since the #1 cause of death of Bahamians is heart disease? I am getting old, Mr. Acting President. I have been doing this for 22 years. George Sherman, before he died, said that he hoped to see a brand new hospital. Dr. George Sherman has died and gone. I hope that before I retire, that we have a functioning cardiac surgical and medical program in the public sector so we can put an end to this nonsense. But I guarantee you that an F&M-led government will do it. Where are the plans for kidney transplantation that in the course of this NHI debate has now been put on the back burner? Where is the plan for an independent morgue and an independent coroner's facility to get those services out of the basement of Princess Margaret Hospital? You know, this is the summertime, Mr. Acting President, and if you come on the private surgical ward on a really, really hot day, we have to use loads and loads of Lysol in order to reduce the smell that leaks up from the morgue. Where are the plans to increase in-house? It's a multifactorial problem. Where are the plans to increase in-house accommodations? You see, I wish that none of us ever have the occasion. We are suffering from a problem with violent crime, and recently things have been slightly better. But if you get shot and you go to the Princess Margaret Hospital, there are no senior physicians in the hospital. So even if I am involved in a patient's management, I have to be called in from home. Because if I want to stay at Princess Margaret Hospital, I got to sleep in my car.
Wow.
When are we going to address that problem? Where are the plans in this national health insurance scheme or the Beck plan that we've not seen? Where are the plans for a step-down unit at Princess Margaret Hospital and the Rand Memorial Hospital? Where are the plans for the maternal child health wing? When will they be revealed? Where are the plans for changing the Princess Margaret Hospital, the Rand Memorial Hospital, and the Sandlands Rehabilitation Hospital to a state-of-the-art teaching facility for full-time training of nurses, of doctors, of ancillary healthcare staff? When will Bahamians get value for money, and when will we become self-sufficient in training our own? Thank God for imported staff from the Philippines, from Africa, from the Caribbean, because we do not take care of our nurses the way we should. Where is the plan, the comprehensive plan to achieve self-sufficiency in nursing, to ensure that our nurses are respected and adequately compensated so they don't leave? When will we move to modernize the medical staff, Mr. Acting President, by hiring exclusively full-time consultants in the major disciplines so that no longer will physicians have to serve two masters, so that the public patients of this country will get the undivided attention of clinicians? And failing that, to contract physicians like me and ensure that we provide a fair day's pay, a fair day's work for a fair day's pay. When are we going to move all of the ambulatory services out of our central hospitals? When will we have full implementation of an electronic medical record system? When will we abolish what I call medical apartheid? Because the abolition of the separation between public and private is essential for quality of care. I conclude, Mr. Acting President, by saying that yes, I agree with the government that this is a start, but it is an inauspicious start. I call it inadequate incrementalism. We have done too little and we have not gone far enough. I would like to give 5 possible reasons why I and the Bahamian people will be disappointed with NHI as currently outlined. 1, I believe, despite the denial and the disclaimer by my esteemed, honorable colleague on the other side, that the primacy of
Madam President, I do note that my learned friend is wrapping up. I just want to move that these business of the Senate do continue beyond 1 o'clock.
7 minutes or so. Thank you.
Moved and seconded that the business of this chamber continues beyond 1 p.m. All in favor, say aye.
Aye.
Opposed, says nay. The ayes have it.
I should be done in a few minutes, Madam President. So I would like to just suggest 5 probable reasons why I believe that the Bahamian public and why I am disappointed with this National Health Insurance Bill and Act, which I will support. 1, the conversation, the spirit, and the intent has had too much attention on the election implications. 2, there has been an unwillingness. I'm sure that we'll have an opportunity to talk about that more. 2, there has been an unfortunate unwillingness, which has improved over recent times, to receptively listen and engage, particularly to individuals who did not drink the Kool-Aid. 3, there has been fiscal schizophrenia. What do I mean by that? We acknowledge that the economy is in trouble, and yet we are about to give a gift of $124 million this year only to the Bahamian people, purely so that they can buy this package, knowing full well that the bill says, and I am certain the plan is, to tax the Bahamian people to pay for it after the election. 4, it is policy myopia, short-sighted vision. And finally, Madam President, I think despite the glowing commentary by my esteemed colleagues, it is a simple inability